Okay. Hello.
Hi.
My name's Abrianna, and I'm going to be your student nurse today. And today I'm here to do a full head-to-toe assessment on you. So this should take me about 15 to 20 minutes. So does that sound okay to you?
Yeah, sounds good.
Okay. Perfect. So can you tell me your name and date of birth?
Spencer Humpel, 7/18/98.
Okay. And I do see that that matches my patient's wristband. Can you tell me where you are?
The hospital.
And do you know what we're doing today?
A head-to-toe assessment.
Okay. And do you know what month it is?
April.
Okay, great. So my patient can answer all of those questions, so he is alert and orientated ×4. So do you have any allergies?
I do. I have seasonal allergies, as well as peanut allergy, as well as tree nuts, as well as pet dander.
Okay, and when you're experiencing those allergens, how do you usually react to them?
Itchy eyes, stuffy nose, with nuts, my airway would swell, my face would swell, hives.
Okay. And then can you tell me your height and weight?
6 foot, 185.
Okay, and I did go ahead and calculate the BMI prior to the exam, and he is at a BMI of 25. So then I'm going to continue on, and before I start my actual physical exam, I'm kind of just taking a general survey of my patient. So I did assess their gait as they walked in the room, and the gait is normal. There was no abnormal limping or any limb dragging or anything like that, so all is well there. Additionally, like I said, I'm taking kind of just a general survey of my patients. So I'm looking at their mood, their overall effect, how they're communicating to me, if they can speak fluently to me, which he is answering my questions well. He seems to be able to hear me good as well, which is good and not indicative of any hearing loss. I'm also looking at his behavioral tendencies and his clothing, and I can see that he is dressed appropriately for the season, and I can tell that he has an overall clean and healthy appearance, so I know that this patient is taking good care of themselves. So now I'm going to actually start my exam, and so I would usually start by taking all of the vital signs, which would be heart rate, respiratory rate, blood pressure, temperature, oxygen saturation, and a pain rating. I'm not going to do that for since we've already had a skill check off for that, but I'm going to ask my patient about pain. So are you experiencing any pain today?
No.
Okay. Had my patient said he was experiencing pain, I would use the 0 to 10 pain scale, and then additionally I would do an old cards assessment on him to gather some more information about that pain. But since he's not in any pain, I'm going to continue with the exam in a cephalocaudal fashion. So I'm going to start the exam just by looking at the hair, so I'm going to go ahead and touch. So what I'm looking for here is I'm just looking at the scalp for any lesions, any abnormalities, any infestations, which I'm not seeing any. I'm looking for any abnormal baldness for his age, which he does not have any. He doesn't have any spots of baldness on his head either, which is good. Nothing indicative of alopecia or anything like that, so all looks well there. I'm also making note of how the hair feels, the texture, the color, and that is all well and healthy. I'm also going to go ahead and check for any step off back here while I'm looking, and I don't feel any. Continuing on, I'm going to go ahead and take a look at the ears while I'm on the side. And so I'm looking at external features first. I'm looking for any scaling, size, symmetry, color. That all looks good. I'm going to go ahead and take a look inside. And I don't see anything abnormal there. No abnormal drainage, nothing like that in the ears, which is good. And do you wear hearing aids?
I don't, no.
And are you ever in an environment, or do you work in an environment where there's potential for hearing loss?
No, I don't.
No? Okay, good. So I'd want to go ahead and mark that in the patient's chart. So again, I'm just going to continue to work down the face here. So I'm looking at the head and the neck, the head, the shape, the size, the color, how the head is positioned on the body. I'm looking at the tracheal alignment, which looks good. The face is nice and symmetrical, and the color is good as well. While I'm looking at my patient's face, I also want to go ahead. Like I said, I'm looking for symmetry, so I want to look at some of those facial expressions, which can help me kind of see if there's droopiness on one side or the other. So I'm going to go ahead to do that, test cranial nerve 7, the facial nerve. So can you close your eyes really tightly? and open them? And can you smile and frown and puff out your cheeks? Perfect. So my patient can do that with ease, so I know that their cranial nerve 7 is intact. And I can also see when he smiled that both sides of his mouth went up, which is good and what we're looking for. So now I'm going to go ahead and start assessing the eyes. And so I'm looking at those external features first. I'm looking at symmetry, and I can see that the pupils are equal and that they are about 6 millimeters, which is good within that normal 3 to 7 range. I'm looking at the eyelashes, and they are pointed up and outward, which is good and what we want. Do you wear contacts or glasses at all?
No.
No? Okay. I'd want to make note of that in the chart, and then I'm going to go ahead and test the pupils. So can you just look right here? And then I'm going to go ahead and shine a light. Good. Good. And then I want you to look right at the tip of my pen and just follow that in with your eyes and don't move your head. Good. So I can see that my patient's eyes are perla. Pupils are round and equal. They react to light and they are accommodating. So that's good and what we're looking for. So now I'm going to continue down the face, take a look at the nose. I'm looking for size, shape, symmetry. It is midline with the body, which is good and what we want. I'm not seeing any abnormalities there. Just going to go ahead and take a look in the nose. Can you look up? Good. And so I'm not seeing any abnormal drainage or anything like that. Also going to go ahead and test for patency. So can you go ahead and cover one and breathe in and out? Okay. Okay. So I can hear a little bit of difficulty breathing there. However, my patient at the beginning of the exam, he did note that he has seasonal allergies, and so I can go ahead and attribute that to his allergies. I will mark it in the chart though. So I'm going to keep going down the face. I'm going to now look at the mouth and the throat. So looking at those external features, I don't see any abnormal dry cracking. It's a nice pink red color. I'm going to go ahead and take a look inside. Good. Say ah. Good. 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 So the uvula did go up and down when he did that, which is good and what we're looking for. The mucosa in there looks a nice red pinkish color, nice and healthy. No cracking of the teeth, nothing like that, and they are a nice white color as well. Additionally, when my patient opened his mouth, I didn't notice any abnormal smells or anything like that, so I know that my patient has good oral hygiene, which is good and what I want to see. So I'm also going to go ahead, before I leave the face, I'm going to palpate the temporal arteries bilaterally. Good. And I feel that that is a normal rate and rhythm. I would document that as 2+. While I'm looking at the neck, I'm also going to go ahead and palpate the carotid one at a time. Good. Good. So I can feel that that is also a normal rate and rhythm, and I would go ahead and document that as 2+ as well. While I'm looking at the head and the neck, I'm going to go ahead and test for range of motion. So can you bring your head down and back, and here to shoulder, and then side to side. Good, and my patient can do that with ease, so he has full range of motion in his neck. Now I'm going to go ahead and take a look at the upper extremities here. So again, I'm looking for color, any lesions. I don't see any abnormalities. The color looks good. I want to go ahead and check temperature. Temperature is good. It's a nice warm, dry temperature. I'm going to go ahead and feel up the arms. Let me know if you have any discomfort or pain. Anything there? Mm-hmm. No? Okay. I'm also going to go ahead and grab the radial pulse bilaterally. Good. And I do feel that that is a normal rate and rhythm, so I would document that as 2+. I'm also observing that there is hair on my patient's arms, which is good and what we want to see. I'm also going to go ahead and test range of motion. And so can you bring your arms up like this and down and back up? And then I want you to pull towards you against me. Good. And then can you push? Good. And then can you take your wrists and go down and up and side to side? Good. And then can you spread your fingers out? And you go. Good. So I can see that the arm, the elbow, the wrist, and the fingers, they all have good range of motion, and the strength is good there as well. I'm also going to go ahead and take a look at the nail beds while I'm here. So what I'm looking for here is no spooning, no clubbing, looking at each of those nail bases, making sure that they are 160 degrees. They're a nice pink color. All is looking well there. I'm going to go ahead and test for cap refill in each finger. It should be less than 2 seconds. Okay. Good. And then the last thing I want you to do is, can you go like this? Good. And then can you do this? Good. So I am seeing that nice diamond shape there in the fingers, which is letting me know that that angle is correct and there's no clubbing or anything like that. So I'm going to continue to work my way down. I'm going to go ahead and start assessing the respiratory system. And so before I begin, I'm looking again at those external features. I'm making sure there's a nice 2-to-1 configuration. The anterior posterior diameter is about 1/2 of the lateral diameter, which is good and what we want to see. So now I'm going to go ahead and take a listen to 14 different points. I'm going to listen to 6 anteriorly, 6 posteriorly, and then I'm going to take a listen to 2 on the sides. So all I want you to do is each time I move my stethoscope, just take a nice deep breath in and out for me, okay?
Okay.
Okay. So go ahead in. Good. Good. So I'm hearing those bronchial breath sounds there. Go ahead. Okay. I'm hearing those bronchiovesicular sounds. Good. Those vesicular sounds. Good. Now go ahead and listen. Good. Now go ahead and take a listen on the back. Go ahead. Deep breath. Good. Deep breath. Good. Good. So I'm not hearing any adventitious breath sounds there. The airways sound nice and clear, and all looks well in that area. So now I'm going to go ahead and take a look at the cardiovascular system. And so I'm going to go ahead and take a listen to 5 different points on the chest. We're going to take a listen to the aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. So I'm going to go ahead and do that. Normally I would want to do this on the skin, however for these purposes I'm going to just go outside the clothing. So what I'm going to do here is to locate my aortic pulse point. I'm going to find the angle of Louis, and I'm going to drop down to that second intercostal space. Right sternal border is where I'm going to find the aortic valve. Good. Then I'm going to go over to the left sternal border, second intercostal space, and listen to the pulmonic. Good. I'm going to go down to the third intercostal space, where Erb's is. Good. I'm going to keep going down to the fourth intercostal space, where the tricuspid is. Good. And now I'm going to go down to the fifth intercostal space on the left-hand side, mid-clavicular, and listen to my mitral valve. This is also where I will take the apical pulse, and I'm going to do that for 1 full minute. And so I do have a pulse of 95. So I'm going to continue now and work my way down the body. So the next thing I want to take a look at is the GI system. So can you tell me when your last bowel movement was?
This morning.
Okay, and when was the last time you ate?
This afternoon.
Okay, perfect. So I'm going to have you lay down, and then I'm going to just lift up your shirt, and the first thing I'm doing is inspecting. I'm looking at the color. The color matches the rest of the body. It looks good. And I'm going to start by auscultating, and then I'm going to palpate. Before I do that, are you having any abdominal pain today?
No.
Okay. Had my patient said he was having some abdominal pain, I would leave that painful quadrant to be examined last. But since he's not in any pain, I'm going to go ahead and start in the right left corner, lower corner quadrant. And what I'm listening for are normal bowel sounds. And so normal bowel sounds, they're 5 to 30 clicks or gurgles per minute, and they're in no type of a pattern, just completely irregular. So good. 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 Okay. So I am hearing normal bowel sounds and all sounds good there. So now I'm just going to go ahead and palpate. So let me know if you have any pain or anything while I'm doing this. And so what I'm doing is I'm really looking for any distension, any masses, anything like that. And I'm not feeling anything. The temperature feels a good, nice, warm, dry temperature, which is what we want, what we're looking for. No pain there?
No pain.
Okay, perfect. And you can go ahead and sit up for me. And so now I'm going to continue on, and I'm going to take a look at the lower extremities. So again, looking at the hair on the legs, and I do see that there's hair there. The temperature of the legs, which is a nice warm and dry temperature, which is what we want. I'm going to go ahead and palpate. If you have any discomfort, let me know. Anything there? No? Okay, perfect. So now I'm going to go ahead and take a look at range of motion. So can you bring your feet up and back down? Good. And then can you pull against me? Good. And push. Good. And then point your toes up, down, and then do circles. Good. And then I want you to push up against me. Good. And down. Good. And then can you spread your toes? And can you scrunch them? Good. And now I'm going to go ahead and look at capillary refill in the toes as well. And so I am seeing that there is less than a 2-second refill there, which is good. While I'm here, I'm also going to go ahead and palpate bilaterally the pedal pulse. So can you flex that? Good. Go ahead, relax. Good. And I do feel that those are also a regular rate and rhythm, and I would document that as 2+. And so that's the end of the exam. So I would put the bed in the lowest position in the locked position, and I would make sure my patient has their call light in reach. Is there anything else I can do for you?
No, I'm good. Thank you.
Okay, I would grab some hand hygiene. Good. That's the end.